Hello everyone, welcome back to my channel. In this video, we'll be talking about the free Multi Specialty Recruitment Assessment, also known as the MSRA exam. The great thing about this exam is it is used in the selection process for specialty training for various specialties, including emergency medicine, anesthetics, radiology, psychiatry, surgery, general practice, ophthalmology, obs and gynae, neurosurgery, and sexual and reproductive health. The great thing about the exam is by taking just a single exam, you can apply for all these specialties if you want, or a number of them. And at the end of the day, if you are selected, you just make a choice out of the lot. So, if you've not liked, shared, or subscribed to this channel, please do so to encourage me to bring up more informative videos. If you're a doctor in the UK or overseas and you're looking to enter specialty training in any of the specialties I mentioned earlier, then you can look at taking this MSRA exam, which is absolutely free, unlike PLAB 1 and PLAB 2. This exam is computer-based, and it can be taken in the UK or overseas. The duration of the exam is 170 minutes, and it basically assesses essential competencies at the foundation level or house officer level. The exam has two components: the professional dilemmas paper, also known as a situational judgment test or SJT, and the clinical problem solving paper. The exam is taken in Pearson VUE assessment centres. These are available in the UK and overseas. So if you want to know if you have a centre in your country or around where you live, there's a link in the description below where you can check this. For some special circumstances as well, remote testing could be considered. I'll start off by talking about the clinical problem solving paper. So this paper assesses higher level synthesis of clinical knowledge, and this part of the exam is allocated 75 minutes. Candidates may be allowed additional time depending on their personal circumstances. So this paper poses scenarios that test candidates' ability to apply their knowledge and use problem-solving skills to make clinical decisions. And the settings of the scenarios provide context, but the judgment required to answer the questions is not specific to one setting. Questions are based on the foundation program curriculum and cover a number of topics relevant to general medicine, which are seen in the box on the slide. The paper tests 5 main competencies: that's investigation, diagnosis, emergency, prescribing, and management. The questions are posed in straightforward language and do not test knowledge that is specific to certain areas to ensure fairness to all candidates. So half of the questions in this CPS paper are extended matching questions, and about half of them are single best answers. So the extended matching questions feature sets out 7 to 10 answer options, each with multiple associated questions. And for each question, candidates must choose the appropriate answer option from the set. For example, candidates may be asked to select the most appropriate drugs from a list to prescribe to several different patients. For each answer option, it may be selected once or more or not at all. Now, for the single best answers, candidates may choose a single most appropriate answer out of 5 to 8 answer options for a clinical presentation. For example, the candidates may be asked to choose the single most appropriate diagnosis after a short clinical case has been given. 1 mark is awarded for each correct answer in the CPS paper. So the other part of the exam, which is the professional dilemmas paper, also called the situational judgment test or the SJT section, assesses a candidate's understanding of situations which may arise while working as a doctor and the response of candidates to these challenging situations. So it does not test knowledge of problem solving. Instead, the content relates to the GMC's generic professional capabilities framework and test attributes that are important for doctors' training, progression, and job performance. So the three main competencies tested are professional integrity, coping with pressure, empathy, and sensitivity. So knowledge of specialty training is not needed, but a general understanding of primary and secondary care work is expected. Just like the CPS, questions are set in the context of the UK Foundation Programme. So candidates assume the role of F2 doctors or foundation doctors, or what other countries may call senior house officer level doctors. Therefore, to make certain the fairness of the MSRA for all candidates, including international medical graduates, questions do not entail any knowledge of policies or procedures that are specific to the UK. Half of the questions in this PD paper are ranking questions and half are multiple choice questions. Typically, the answer options are actions that can be taken in response to the circumstances given in the scenario. Good, acceptable, and poor actions are included as options, as is the best action, but unrealistic actions are not included. So for ranking questions, candidates are expected to rank 4 or 5 actions in order of appropriateness, with the first and last ranked options being the most appropriate and the least appropriate respectively. I think this will make. When it comes to resources for this MSRE exam, the Health Education England or the various specialty recruitment faculties do not endorse any particular resource for preparation. However, some individuals or companies have come up with question banks which could be helpful in preparing for the exam. These would require a paid subscription, therefore one could explore by Googling them, finding out the costs and checking to see what works for you. So these include eMedica, Pass Medicine, Pass Test, MCQ Bank. I believe there may be other question banks out there. So if you're a doctor who knows of other question banks as well, please feel free to drop them in the comments section to help those interested in taking this exam. So how is booking for the exam done? First of all, one needs to create an account on the Oriel website. I have dropped a link to the Oriel website in the description below. Also, if you have not completed UK FPO Foundation Program, then you need a CREST form to be signed. CREST simply means Certificate of Readiness to Enter Specialty Training. So particularly for international medical graduates or overseas doctors hoping to start specialty training soon in the UK, this is a form that needs to be filled. After submitting the registration form and the CREST form on the Oriel website, if you are invited to partake in the MSRA exam, subsequently a Pearson VUE account will be created for you. Then all other forms of communication will be via email with step-by-step procedure on how to proceed. On the day of the exam, it is very, very important for candidates to arrive on time. This is because lateness is not acceptable. They therefore advise candidates to arrive 15 minutes before time at least. Candidates must ensure that they carry their appropriate IDs along, and before the exam day, they would receive emails detailing which forms of identification are acceptable. Also note that in the exam room, there will be an optional 5 minutes break scheduled between the professional dilemmas test and the clinical problem solving test. Now the results. The outcome of the exam is usually given weeks after the exam is taken, and this is usually communicated via email or on the Oriel website. I've already talked about the Oriel website, and there is a link in the description below to access this. So the results are banded. Band 1, indicating very poor performance. Band 2, below average performance. Band 3, good performance. And Band 4, very good performance. Candidates should therefore aim at getting a Band 3 or a Band 4. But in the worst case scenario, a Band 2 at least in either the CPS paper or the professional dilemma test. Please note that each specialty uses the MSRA score differently, so it is useful to check specific national recruitment websites for further guidance on the specialty of one's choice. For the majority of specialties, scores will be used for shortlisting candidates for the various specialties, as well as contributing to one's overall ranking and during the interview process. I hope you found this video informative. Thanks so much for watching. Please like, share, and subscribe if you haven't. If you're a returning subscriber, thanks so much for coming back to watch my video. Note that I have more informative videos coming up, so stay tuned. And if you're a doctor looking to get a job in the UK, looking forward to specializing, or looking for up-to-date information regarding work in the UK, please always come back to watch out for new videos. Thanks very much. Bye.